All right. Welcome back, everyone, for our final post-professional occupational therapy doctorate capstone for today. Our last presenter for this afternoon is Reid. She's an occupational therapist with many years of experience. She has a nonprofit organization and a private practice where she works with individuals who are survivors of sexual abuse and have been trafficked. And she's exploring the use of equine therapy. She's done both of our trauma-informed certificate and then mixed some things together for the second one. So she's had a big piece of different things going on as she's done her performance and her work. So without further ado, Erica, take it away.
Thank you, Dr. Carey. As she said, I'm Erica Reid, and I am presenting my capstone experience on developing a 6-week equine-assisted therapy program for reducing symptoms of PTSD and increasing quality of life in survivors of sexual abuse. Of course, I started with my literature review, and there were some significant discussions in the lit review. To nobody's surprise, I'm sure the impact of PTSD on survivors. Sexual assault survivors often face PTSD symptoms, such as intrusive memories, hyperarousal, diminished quality of life, and impaired emotional regulation, which is one that I concentrated on. The limitations of traditional therapies. The research tells us that psychotherapy and pharmacological approaches only succeed for about 50% of patients, and unfortunately, it's even lower rates among veterans. There is a need and a desire for alternative interventions. Yay. These creative therapies, like equine therapy, may address the nervous and emotional system imbalances caused by trauma. And I think that's some of the most important aspects of our work. So I'm very excited about that. The therapeutic potential of equine therapy by fostering human-animal bond. We know by science that the human-animal bond helps to increase our wellness and our overall health. And this is actually what got me into occupational therapy. I got into vet school. I got into a school for psychology, and I walked into the career room and I saw this OT thing where I could work with people and animals together, and I was hooked. And so that was kind of the start for me. And here I am 20 something years later, finally working with the two. So the population itself of abuse survivors, again, no surprise, high rates of PTSD that require specialized interventions because of the unique challenges. Unfortunately, there's a big research gap in that most of the focus is on veterans. But that doesn't change the fact that PTSD's impact is profound, long-lasting on relationships, daily life, and well-being. That sounds like a lot of OT right there to me. The evidence showed that there were significant PTSD symptom reduction across various groups. So this included all trauma origins, veterans, first responders, sexual abuse survivors, and those with complex trauma. Some of the key improvements were that emotional regulation, reduced intrusive thoughts, and enhanced coping skills. And then as far as quality of life, there were reductions in anxiety and depression, enhanced mood and resilience. There was a lot of trust building, confidence, and healthy relationships for the empowerment key. And then there was a lot of discussion on how it was such a non-judgmental space, which we know aids in recovery and emotional healing. My goals with the assessment were to gather qualitative data on the needs through the equine therapy for the survivors and find these needs that could be addressed through this equine program, and then create a foundational plan that would address them. So I interviewed 3 different people: a psychotherapist that uses equine therapy for sexual trauma recovery, an equine therapist working with different populations. She works with AA group, she works with special needs children, and she's also worked with some of the survivors through my nonprofit. And a sexual abuse, actually a sex trafficked individual who's also an advocate and had some minimal equine assisted learning experience, again, through my nonprofit. And they helped me to identify unique needs of survivors and then explore the equine or horse therapy role in this trauma recovery. So 4 areas came up. Some are not surprising. One was pleasantly surprising, the play and pleasure. We understand that sexual trauma reduces joy. And so I made it a point to make sure there was a lot of horsing around in interactions in my program, and some nature-based mindfulness to foster that joy and bring back that exploration of pleasure. Trauma informed, of course, no surprise here. Survivors require specific trauma informed ways to be really sensitive to their needs. And I wanted to make sure that it was a trauma sensitive space that also allowed for this nonverbal healing activities and for autonomy, community and connection. Survivors often feel isolated. And so I wanted to make sure that we promoted belonging through outdoor activities, horse interactions, and through the supportive therapeutic relationship. And then reparative relationships. Survivors often struggle with trust, and rebuilding relationships is vital for recovery. So there was a lot of trust building, and not, which is really nice to be able to do because the horses are so non-judgmental. And there was a lot of fostering empathy and human connection through these nonverbal cues. And these are some of the things that we worked with throughout the 6 weeks. So outcome evaluation, there's 2 ways that I measured the effectiveness through standardized testing. One of the ways is through the COPM, Canadian Occupational Performance Measure. We did this pre and post program, and this measures the changes in performance and satisfaction in daily activities. And then the second one was the ERQ, the Emotional Regulation Questionnaire. And this helps to evaluate emotional regulation strategies like cognitive reappraisal and expressive suppression. So this was done pre and post as well. Go back there. Let me do. Oh. I don't think I can get back there without getting this thing out of my way here. Give me 1 second to hide the magic cursor. Okay. Well, let's see if I can go off my memory here. On the other page, there was considering feedback from staff, if there's any staff involved. And in my particular program, there were no staff involved, but sometimes you might have some horse handler or some other barn personnel that would be there to assist. There was the satisfaction of the participants themselves and doing semi-structured interviews with them before and after. There was also checking in and to make sure that I was consistent and was adhering to trauma-informed principles, as well as leaning towards those therapeutic goals. So the results with the ERQ, let's start with that one. With client 1, cognitive reappraisal increased from 10 to 13. We want this one to go up. Expressive suppression decreased from 18 to 12, and that's the right way we want those numbers to go. So both these reflect in enhanced emotional adaptability and less reliance on maladaptive emotional suppression. The cognitive reappraisal for client 2 increased from 13 to 18, and expressive suppression from 14 to 9. So this shows improved emotional adaptability and reduced emotional suppression. Both clients surpass these averages. The typical for survivors is 0.5 to 1.5 increase in that cognitive reappraisal. So that was surpassed. And then with the expressive suppression, the average is 0.5 to 1. Again, that was surpassed as well. With the COPM, client 1 performance scores improved from 4 to 5.6. Satisfaction scores increased from 4.4 to 5.8. And then for client 2, from 2.6 to 6.2, and satisfaction scores rose from 2.4 to 6.0. Now the average on these is 1 to 2 points. So I love how much we surpassed those. And I really appreciated this test because it wasn't just testing the performance, but how satisfied the client was with their performance. And I just find that such a vital part of all of this. Key gains for client one: felt safer in public spaces, engaged in more walking activities that triggered her before, and reduced triggering concerns. And this was kind of a huge thing. And I want to take a minute on this one because what was happening at that time is the trigger concerns that this client had were Halloween. It was Halloween props and seeing Halloween items. And we were right in the middle of Halloween, especially when I did the post-program assessment. So I really did not think this would get better. I thought it would get worse. And so it was a pleasant surprise to see that she felt reduced triggering with that. Now, she did have the two goals that she set with me. One was on sleep improvement, and then the other one was social connection. She wanted to see more uh, equal reciprocity, if that's the word, with relationships. It felt like she was just giving so much with relationships, and she wanted to receive that back. She did not meet her goals at a measurable level. She did feel like she felt better about them, but did not actually reach those goals. And client two, key gains was an increase in sleep duration, pain-free wrist function, greater community engagement. His goals were actually to achieve pain-free wrist function and also not to have to feel so cautious about worrying about his wrist pain all the time. And then he had a goal to increase sleep by at least 1 hour. He met both of these goals and was very excited to see both of these happen. And I should say also, both these clients were, I don't take a specific, I happen to know their sexual abuse history because I've been their OT for about a year doing myofascial work and other things like that. But I don't ever have clients repeat their story or thing, but these are two clients who, client one was in therapy for she's been in therapy for probably at least 10 years in psychotherapy. And then she was on and off seeing me throughout the year. Whereas this gentleman was seeing me sometimes up to 4 hours a week. We worked on many different things. It wasn't always a focus on his wrist, but all of this improved within this 6-week period versus the year before, none of this happening. So discussion, and as we know, trauma disrupts emotional regulation, and the horse's intuitive and instinctual nature, this is what helps trauma survivors because of but the ability to bypass this verbal disclosure. They don't have to sit there and talk over and over about what happened to them. Instead, we're fostering mindfulness and grounding and nervous system regulation, which I think is everything. The impact on quality of life we saw through the standardized testing and the interviews, all positive results. Program challenges, there were and can be challenges in this type of program. Logistics and scheduling, so requires a lot of flexibility. We had to work a couple times to work around weather conditions. It was just way too hot to be at the ranch one week. We had to skip that. It's quite a bit of a drive for one of the clients, and driving triggered her. So we had to really work on scheduling a time that worked for her. Individual variability. This is a huge one. Meeting clients where they're at. And the female client did show up a couple times, very closed off, not receptive. And it was a time that I had to just drop all the plans for the day and work on just working with her nervous system and really helping her get in that parasympathetic state, because we weren't going to get anywhere if we just tried to drive in and just try to meet the plan for the day or the quota for the day. Emotional physical safety. I mean, we're working with 1,000 to 1,500 pound animal, so we always want to ensure that there's safety around that. And prevent re-traumatization, which I think having that non-verbal working with the horses, not having to repeat our story and talk about it all the time, I think it is huge to help with that. And then there's always resource limitations that could be possible, funding for programs like this. And fortunately, I was able to work with the horses and use the barn facility at no cost, but that can be a limiting factor. Alignment with OT. So equine therapy offers a client-centered occupational-based approach. So that right there says a lot. Helps to build self-awareness, trust, and emotional safety. Therapeutic work with horses empowers participants in relational dynamics and co-regulation. And then these skills can transfer to daily life. There are a couple incidences where something would happen when the client was working with the horse, and we would stop and say, well, where do you feel this, or where do you see this in your life right now? And then how do you think the way that you responded to the horse, or the way that you felt, how can we apply this to the situation in your life? Implications for OTs. OTs are well suited to lead equine therapy, integrating physical, social, and emotional health. So biopsycho social approach, that's our jam. Horses create a therapeutic space for that nonverbal healing I mentioned. And then we see that the research supports the potential of equine therapy to improve PTSD. Oopsie. And I'm in this situation again. Here's what I'm going to do. Just to go back. Here we go. There. Should have thought of that one last time. Relevancy or transferability is another word I was using for OTs. The trauma form approach, which I think every OT should have. We're able to use this it's very important to use in this trauma arena. So we can use it with the horses, we can use it with whatever modality we are applying. There is a structured framework that's replicable, but also it allows a very flexible structure as well to be built upon it, depending on how the client is that day, how the weather is, how the horse is. And then, of course, there's standardized tests for the outcome measurements, such as the two that I used. OT limitations and challenges. If someone's living in an urban area, it might be hard to find equine facilities that have horses that are able to participate in this, because not every horse is appropriate for equine therapy. And the ranch and the owners of the horses need to know their horses, and there's a lot of discussion around that. Training requirements, there might be additional training someone wants to do. I myself have, through my nonprofit, I've seen a lot of the work done. I spent a week training, if you could call it that, watching another nonprofit and learning about some of the activities that can be done. And that's all. I used my OT skills, because that's where we shine. We're able to take any situation and the tools that we have in front of us, and we're able to bring them together to help someone with their ADLs and their ADLs, right? So we're able to adapt to any situation. And I feel that that is very, very possible with this work. But there is also the opportunity to do some extensive training. I thought I would be doing no more schooling after this, but in January, I am starting a specific trauma-informed equine therapy training where I'll be able to say I'm an equine occupational therapist. And I'm super excited about that, but it's not necessary. But if, continuing ed, for those of us who want to dive deeper into it, it is available. And of course, cultural adaptability. We want to align to cultural context and client preferences. Future considerations, definitely longer term interventions for clients with deep-rooted trauma. The first client, the female, I would have loved for there to been to go on for much longer with her. Her trauma is much more deep-rooted. There could have been a possibility for many more changes. And then training occupational therapists in trauma-informed and sensory-based approaches. I think this is something every OT should be trained in, and I hope that that is the way that we are going. And then this can just be brought into that equine-assisted therapy space. Same thing with, learning to providing a feeling of safety for our clients, and using the polyvagal principles. Strengthening interdisciplinary collaborations. So even in my work in my office, I'm working with, I may be doing manual techniques, but in my mind, everything I'm doing is to bring that nervous system down so that they are in a place of healing, of rest and digest, because we cannot heal if we're not in that space, right? So I get calls from psychotherapists saying, "What have you been doing?" Now my client is making bigger gains and getting deeper level of healing. This can be found, same thing, working with the horses because of the approach that we're taking and working on that nervous system and all those elements of boundary setting and trust and everything that I listed before. So I think there's a huge place for us to collaborate with other therapists and let them see what we're doing and how we're getting there and why this approach is so important. Lots of references and even more gratitude. I want to give gratitude to my horse, Reva. That also almost makes me tear up because she has been just a super inspiration. They say that you find the animal that, or maybe the animal finds you that really will help you see more into yourself. I mean, that was the point of this whole program. And even just my relationship with my horse has been that. And then, Dr. Carey, I want to give lots of gratitude to you. I can't see you right now, and I don't have your picture up here, but I know everyone else can see your beautiful face. And you know how much you have supported me. You believed in me doing this. I actually am going to pull up your picture now. In such a short time, you were my cheerleader, and there's a good part of the reason I'm here is because of you. Upper, I guess that would be on your right corner with the smiley face is one of my clients. So I want to thank the two participants who were so willing to come and drive out there and be there and be a part of this and participate. Um, Ava is the one on the table in the corner. She is the owner of Special Spirit, which is another foundation where they provide the equine therapy at the ranch. And as I mentioned earlier, she allowed me to do this there. Here I am treating her with myofascial techniques with her horse in the arena. And her horse came right to the area where she needed some extra love and care. And last but certainly not least, my boyfriend, who is on the call. We had a joke at the beginning that when I got my doctorate, he was going to get his therapy degree because he had to counsel me so much. It was a really hard transition in the beginning, being an older student and diving into this, and his patience and his love were very much appreciated. That's it.
Well, I'll start by congratulating you on an excellent presentation. I did want to shout out to Erica. She's the first person who came to us with a bachelor's and completed both the bridge and the doctorate in under a year. So she took three classes continually the entire time and did really incredible work. So congratulations for your accomplishments. I know you were on a mission when you started, and I think you've achieved that and more. I'll open it up to questions. Tam, I see
So,
your,
yeah.
yeah.
So, Erica, thank you for this very important work and sharing your project with us. Can you just give me an idea of what a therapy session might look like? What would be the activities that you would actually do in a session? And I know it would be different based on, the goals and what you are attempting to accomplish, but I'm just curious what that would look like.
Yeah, absolutely. A lot of times I'll start with a grounding activity, and that might be something away from the horse or with the horse, which would be just having them brush the horse and feeling the sensations that they're feeling in their body, feeling the breathing with the horse, maybe having them match the breathing of the horse. And then some of the activities are um, there's there's an activity we do where we have them take whatever's in the arena and build a safe space with it. And that's going to look different. That's the only instruction I'll give them. And there's some poles and different things laying around, and they'll make what to them is a safe space. And there's a couple different things we'll do with that. I might have them stand in it, and I'll bring the horse right towards them and ask them to work on saying no when they want the horse to stop, when they're where they feel their boundary is. Or they might work on, I'll say, let's bring the horse into this area. And I won't give them any other instructions. And they have to figure out how to get the horse there. Now, sometimes somebody will just grab the horse and start pulling them. And the horse is going to say, no way, that's not happening. So we start talking about, well, what do you think the horse is thinking? How does that make you feel? What other way, if this was a person, would you work with them? How would you communicate with them non-verbally to come with you into this space? And then they have to start thinking about what might be a great way to lead them over there. There's many other examples, but one thing I want to mention is it's not about writing; it's mostly groundwork. However, I did have each person, if they felt comfortable, and they both did in their separate sessions, I had them sit on top of the horse, and I'm going to tear up again. But one of the female was she mentioned that this was the first time she was able to sit on something hard that wasn't going to hurt her. And she was able to work with that and process that in her body. Yeah, there's so many examples, but that's just kind of maybe one day.
Yeah, that's very
Okay.
helpful. Thank you.
Yeah, I think it's important to note that I've heard a lot of the stories about some of your clients and their the sexual abuse for some of them occurred over the period of many, many years. And they haven't one was started as early as 5 and has it's been many, many years. And I think that's an important thing to note.
Yeah. Yeah. The female client was trafficked by her father starting at 5 years old. So a lot of deep rooted. 6 weeks was just the touch, but I was certainly impressed with the results. And not just, I'm not a numbers person in that respect. Standardized testing was that was fun. But more of the qualitative, like just seeing her light up. And even when she would come to the ranch, it taught me a lot, and it continues to teach me about myself too, because, my first thing when she would show up so closed off was take it internally. This is my fault. And then I have to remember, no, Erica, this is what you're here for, is to help her. And just push away everything else you had planned for the day and let's work and meet her where she's at. And this has nothing to do with you. And it was such lessons every time for me as well, which is what I experienced with the horses in general and why this work was so important to me. And within my nonprofit, girls come to work with me as a pelvic floor therapist and as a myofascial, but everyone's favorite is working with the horses. And I think it's quite obvious why. It's such these huge animals that they learn to feel so much trust and respect with, and that really help them to regulate their own body. And I mean, that's everything right there.
So I'll ask one question. What do you plan to do from here?
Well, like I said, I thought I was done with schooling, but January 15th, I'm starting with a program. It's called Natural Horsemanship, and I'm going to take their training to learn to dive really deeper into the equine therapy relationship, and I will have the title of equine occupational therapist. So that work is just, I really want to dive into that, offer that for my regular clients as well as within the nonprofit. And my dream is really just to build up the nonprofit more than anything else. If that's the space I'm in and, I let my office go, I'm okay with that, because this is the sexual abuse, the sex trafficking. These are areas that are just so prominent. And there's not a lot of, I hesitate to say the word alternative, but holistic healing, which,
Mhm.
we are OTs and we are holistic healing. And I want to say something here because I think it's really important. I had a student a number of years back, and I had started my nonprofit. And I never mentioned when I started it, I never talked about being an OT. Like, I just thought that was going to hurt me because nobody knows what OT is or anything, right? And she was the inspiration. And she's like, you have to mention, you have to make this all about being an OT, because that is the holistic approach. And there's a lot more to unpack behind that, but it stands out in my mind so much now because and getting this doctorate just really helps, is just going to help me really bring that out even more, right? Because it was something I just wanted to hide. I used to tell my boyfriend, just tell people I'm a PT, so there's not 50 questions. And now it's like, no, I'm an OT. Well, what's that? Well, here we go. So it's just, so for future for me is just to really take that and run with it. I mean, this is why I became an OT, because of that holistic approach. And the fact that we can work with animals and we can work with this or we can work with that and we can do all these different things and there's so much variety, but it all comes back down to what we're really doing. And with the nervous system, with the healing. And that's what I love doing. It's my passion.
Well, excellent. You do it well. So thank you. You did a great job. I'm going to stop your recording.